Oh my goodness. WTF, PMS, PMDD, all the PMs, all the premenstrual stuff. So many of my women who I see, love, and adore are dealing with these issues. And until I ask them about it, they don't even realize the connection. So let's talk about it because, my love, there are things you can do to help yourself feel better. Hello, my loves. Dr. Holly here. Love you, adore you. I'm a little crooked, I feel like, so I'm kind of holding this thing, but then I want to use my hands. So let's just pretend I'm not crooked. Okay. I love you. So I see so many of my women folk, and so many of you have issues around the time of your period, especially when we get into our perimenopause stage, that kind of those years where, things are starting to slow down, maybe get a little irregular. Even before that, though, folks talk to me about bloating, about headaches, about GI issues, and just kind of feeling off, right? Like maybe a little crabby, maybe a little more tearful. Maybe that Johnson & Johnson commercial is a little more touching than it was the week before. That can mean PMS, premenstrual syndrome. Now, if it gets into the space of like anger, really like emotion that's difficult to manage, seems almost out of the box, or anxiety that's super high, intensified, maybe there all the time, but even more intense during that week, that's when we start talking about PMDD, which is premenstrual dysphoric disorder. Now, people at one point thought it was just like premenstrual depression and that's all there is to it, but it can be more than just feeling sad and down. It can also be irritability. It can also be just emotionality. Is that a word? I don't know. I'm going to make it one. But just feeling like hyper emotional, not your best self, really wanting to almost hide away because you're not your best self, right? It's a terrible place to be where you're not your best self, but like it's almost like your mind is taking a mind of its own. I didn't do that on purpose, but I just did it. Anyway, so my PMS, my PMDD loves, I adore you. We talk about this all the time when you see me. If you're not sure if maybe you are in our tribe, then try one of those apps, dude. There's all those apps that help you track your periods. Sometimes for folks who are like trying some fertility, sometimes for folks who are maybe perimenopausal and are trying to figure out like what the hell is going on. Whatever one resonates with you, try that because that might help you notice if perhaps some of the things that you're dealing with are happening on a cyclical way. So in the PMDD special world, there's a lot of talk in conventional medicine about how to treat it. Folks usually go to one of the SSRIs like Zoloft or Paxil, Prozac, all those kind of serotonin reuptake inhibitor medications. Sometimes folks take them all the time. Sometimes folks just take them cyclically during the luteal phase, which is that week before your period. Between ovulation and period time. That's when things kind of go crazy. Not literally crazy, but you know what I mean, like make us feel like maybe we're a little nuts. Some of my folks who are more in the hormonal world will try using hormones, although honestly, there's not a lot of research that supports this, especially for the mood. There might be some help if there's some bleeding issues or more of the physical complaints that folks are talking about, but not so much for the cognitive complaints, that brain fog, not so helpful, not so much for the mood, not so much for the anxiety. The research just doesn't support it. So, a place for it depending on what you're addressing, right? Or if you just need some birth control. But those things come with their own side effects, right? I have folks who deal with depression for years, get off of their antidepressant or off of their birth control, no longer need the antidepressant, no longer need to be treating depression because guess what? The hormones, the external hormones were what was contributing to their feelings. So just stuff to keep in mind, right? So in integrative medicine, we love to talk about the root cause. We love to go to what is it that is making things behave the way they are. So, because it's cyclical, folks love to say it's the hormones. You must have a hormone imbalance. Well, interestingly enough, when we look at our ladies who have PMS or PMDD, their hormone levels are generally not unusual. So it seems that their bodies maybe are responding differently to the changes within their hormones. Now, sometimes these differences can be because of cofactors not being present. So we look at our vitamins, we look at our minerals, we look at those levels, because sometimes if those levels are in deficiency states, that predisposes our women towards that PMS or PMDD if it gets severe. So something to keep in mind, right? Also stress. Stress can worsen these things. I mean, stress worsens everything, right? Especially these days. But definitely something to keep in mind. So a lot of the adaptogens and things I use for my folks for general stress seem to also help them with their PMS and PMDD. Other things that we like to look at is how your autonomic nervous system is working. So that, again, is kind of that stress response, but also the cortisol levels and bringing those down to normal, or to whatever normal is. And that's when a lot of our mind-body medicine factors can get into play. We've noticed that women who are predisposed to PMS or PMDD have heart rate variability, which is not very high during that luteal phase, that phase right before your period. So that means that they're more in kind of a sympathetic mode, or in a like fight or flight type of space. Versus the relaxation response that we love to have you in. So your brain can heal and your body can heal, and your inflammation can lower, which is a whole another part of this. So using a lot of the mind-body medicine, things like therapeutic yoga, things like guided imagery. I love me some guided imagery. If you can find one that resonates with you, it can be so helpful. You can find them to help you go to sleep, because sometimes sleep is a difficult thing during this period. Or you can help them just to help you relax, doing some relaxation, some body-led relaxation is super helpful. Also, the heart rate variability. Folks like myself who are trained in heart math are able to help you with kind of more of a biologic kind of led mind-body medicine, where we do some biofeedback, looking at your actual heart rate variability and using some heart-centered breathing and getting you into a state where that is at a place that is heightened, which means you're in more of a relaxation state and your body's able to heal and you're feeling good. And lo and behold, that anxiety, that depression, that irritability is lowered. So all of these things are possibilities in the world of integrative medicine and integrative psychiatry. If you want to know more, please reach out to me and we can have a phone call, we can have a session. I adore you. So if you don't know how to get me, it's darawellnessnola.com. Also, please like and subscribe over on YouTube, and that way you can be alerted when I have these videos, and like and subscribe wherever you're seeing me on social media so we can stay in touch. I adore you. Have a wonderful rest of your day. Bye, my loves.